Hello, good good evening. Good today. We talked about speech language development in children last week. We have the one today. We have the part two, speech and language development in children. I hope you enjoy the presentation today, and I hope you continue it. So if you have children who are pregnant, and nothing more than father to infants, send them the link mail so that they can join if they are busy and use it and work. So are you all doing? I believe you're doing well. So hear from me. This is started putting to use the things you've learned past few weeks. So this is take the next challenge. Put them to use.
Okay, so before I go into what we'll talk about today, I'd like to define speech and language respectively. Usually, people call any speech and language, speech has its own definition, while language has its own definition. But people use the terms interchangeably. They'll just say, "Oh, my child has speech defect." Even when it is not speech, they still refer to it as speech defect. So today you will know the difference between speech disorders and language disorders. So I'll start I'll start giving the lectures by 3 on the dot so that those who come online by 3 will not feel like, oh, they already missed something. Yeah, you can always make comments. Use the comments icon. You can ask your question under the comments. I'll see your question and respond to them. If I do not respond to your questions now, I'll do that later. Thank you. So we start. You know, like I said earlier, we had the part 1 of speech and language development in children last week. So if you missed that live video, you can go to Speechy Haven. You can go to Speechy Haven on YouTube or Facebook and you'll find the video there. Just watch it so that you understand what we discussed last week. We actually talked about the developmental milestones with regards to speech and language development in children. So today we'll be talking about speech and language disorders in children. Since we've talked about the milestone, that's the normal things that should occur when children are growing up as regards speech and language. So now we'll talk about when the disorders, when things are not going right, when the milestones are not being achieved with regards to speech and language development. So now I'll start by explaining what speech is and what language is. Okay, excuse me, let me share the link. Okay, so speech is how we say sounds or how we say words, how we produce them. That's what speech is. So when we say a child has speech disorders, it means they are not pronouncing words the way words should be pronounced. It means they are not saying words the right way. So when you say a child has speech disorders, maybe when the child speaks or when the person speaks, the words do not come out clearly. They maybe the articulation, the pronunciation, even the enunciation do not come out. The child cannot get the words out clearly. Or maybe the child's voice is hoarse, like, or harsh and rough. That's speech disorder. Speech disorder is also when a child or an individual is repeating speech sounds. Like instead of saying baby, they go baby. That is speech disorder. So some examples of speech disorders are stuttering, articulation disorder, speech defect as a result of cleft palates, and maybe other deformities such as tongue tie. So this will lead to a child having could lead to a child having speech disorder. While on the other hand, language is the words we use. Language is the word we use when we are sharing ideas or when we want to get something. When we are sharing ideas with people, when people are speaking with us, the way we understand what they are saying, especially if it is being said in our own dialect, in the language we know and understand, that is language. So when we say a child has language disorder, it means the child is unable to understand meaningful conversations you're having with a child. You're speaking with a person and they can't understand you. That's language disorder. Then the child has problems stringing words together, like, I want food. Can I have some apples? And instead of saying that, the person goes, go apple, come food. That doesn't make sense. That is language disorder. Also, when a child has difficulty in reading or understanding what they have read, it is language disorder. Also, when a child has issues writing, it is language disorder. When a child has selective mutism, that's, we can say an individual is selectively mute when in public places they have issues communicating with people. Even though they can speak, they can understand what is being said to them, but when they get to public places, they just don't communicate. You talk to them, they are quiet. People would even think that they cannot speak, or maybe they are deaf. Such a child is selectively mute. The child is selectively mute in the sense that the child would select a set of people to communicate with. Maybe is only comfortable amongst children or amongst boys or girls. So when this child is sitting around boys or girls, they would communicate normally. But the moment another gender comes around, the child will just go mute. Or the moment an adult comes around, or a set of people they are not comfortable with, the child will go mute. So that's selective mutism, and it is a language disorder. So now let's talk about the causes of speech and language disorder. Speech and language disorder can occur. It can occur in any stage of a person's life. It can occur before the child is even given birth to. Maybe as a result of ailments during pregnancy, or as a result of exposure to radiation, due to toxic substances ingested by the mother, due to, these are the causes. These are some of, maybe genetic mutation. Yes, these are things that could lead to speech and language disorder before a child is even born. Then when a child is born, after delivery, Even during delivery, if care is not taken, maybe prolonged labor, wrong use of forceps, deprivation of oxygen, these are things that could lead to a child developing speech and language disorder during delivery. And after delivery, a child falling sick as an infant or toddler could develop speech or language disorders. Sicknesses such as measles, meningitis, and lots more. Those sicknesses that occur during the time when the child is little. Even a child falling down and hitting the head on the floor could lead to the child developing speech and language disorders. Accidents could lead to the child developing speech and language disorders. And also some neurodevelopmental disorders. When children have disorders like autism, ADHD, epilepsy, and Down syndrome, cerebral palsy, these are medical conditions that could lead to a child having speech and language disorders. So now let me talk about speech and language disorders, the causes based on deformity or underdevelopment in parts of the brain that control speech and language. If during pregnancy or during infancy, a child's brain does not develop well the way it should, it can lead to speech and language disorders. So that is why we usually advise pregnant women and nursing mothers to make sure they eat well and feed their children well, so that the children will develop normally. Another cause, I've mentioned it before, but I'll buttress further. Another cause of speech and language disorder is accident or sickness. Like I mentioned earlier, measles, meningitis, and the other sicknesses. Those sicknesses we take vaccines against, or we ask people to make sure their children are vaccinated against. So these are things that could lead to speech and language disorder after delivery. And also, we have structural deformity. When the structure of the organ of speech has deformity, it could lead to speech and language disorders in children. Take, for instance, tongue tie. I know sometimes people tell parents that, oh, tongue tie doesn't matter, but no, not all tongue ties do not matter. Even lip tie, it could lead to articulation disorder in a child when a child has lip tie. Imagine that your upper lip is stuck to your gum. You can't move it. There are certain words you won't be able to pronounce well. Or imagine that your tongue is stuck to the floor of your mouth, like this. Now try to say S, F. I'm sticking my tongue to the floor of my mouth now. And I'll try to pronounce the sound S. Did you hear that? It's not coming out as S, it's coming out as. So imagine your child wants to say, I'm going to school with tongue tie. I'm going to school instead of school. Cool. So do you want that for your child? I guess you do not want that for your child. So when you are told that, oh, tongue tie doesn't cause anything, try to see if it affects your child's speech and your child's speech, your child's pronunciation. If it affects, even if it's just one letter, S or D, daddy, even if it's just one or two sounds that are affected, please still go for the detachment. It is called frenectomy. Go for frenectomy. It's a very minor surgery. They would free the tongue so that the child will be able to speak better. If you are told that it doesn't really matter as long as your child can speak and your child can eat, can feed well, just leave the child. Wait until the child starts speaking. When the child starts speaking, assess the child by yourself. See if the child has issues with t, t, d, s. That's letter D, letter S, letter T. Even, in fact, check all the sounds. Check all the letter sounds to see if the child can pronounce everything the way they should. And if your child cannot, please insist that they do a frenectomy for that child, because it's going to affect the child's articulation. And after you do a frenectomy, do some lingual muscle exercise. That's, make sure after recovery, you help the child exercise the tongue so that the tongue does not stick back to the floor of the mouth. Sometimes it happens that even after frenectomy, the tongue will stick to the floor of the mouth. Why does this happen? Remember when you have a cut, take for instance, you have a cut in between your fingers, and then you treat the cut. Over time, it's going to heal and join back. Yes, it's going to heal. So same thing as the tongue. After frenectomy, after they free the tongue so your child can speak well, if you do not help that child exercise the tongue, the cut could heal and the tongue will stick back to the floor of the mouth. And then you will still have the tongue tie again. So here is what you can do after frenectomy. Help your child exercise the tongue. Ask the child to elevate the tongue. After the tongue has healed and your child can eat normally now, then you ask the child to lift the tongue. Ask the child to lift the tongue towards the roof of the mouth. Move it right way, left, down. Just keep moving it. You can do this several times in a day. If you help your child while brushing, you can just quickly do the exercise, the lingual muscle exercise. Ask the child to move the tongue, especially upward. Do it several times. Move it right, left, then over time, the tongue will get used to not being attached even after the surgery, and your child will do well. So that's about structural deformity leading to speech disorders. So now we have cleft palate. Cleft palate is one of the causes of speech disorders in children. When a child has cleft palate, sometimes we have cleft lip, just cleft lip. Sometimes the child would have cleft palate, and sometimes the child will have both. In a case of cleft lip, you will see there will be a cut around the lip. There will be a cut on the lip. This can be corrected through surgery. So usually the surgeon would correct that by cutting another part of the skin and attaching, or by joint, depending on how wide the cut is. They would fix that. And after cleft palate surgery, cleft palate or cleft lip surgery, ensure that you do speech therapy, especially if the child is above age 1. Ensure that you do speech therapy, because a child with cleft lip and cleft palate, or cleft lip or cleft palate, would, by the age of 4, 5, would have learned how to speak the wrong way, because the cleft lip and palate affects the way the speech sounds are produced, the speech production. So the child over time has learned how to speak the wrong way. So even after the surgery is done, people usually think, oh, after cleft lip or cleft palate or cleft lip and palate surgery, my child will just start speaking. No, it doesn't happen that way, especially if the child already acquired speech and language, like the child is already up to 4, 5 years of age. So you do speech therapy, you make sure you enroll your child for speech therapy so that the speech therapy will help correct the child's speech error. Every error the child has been making, even after surgery, the child will still continue making such error if there is no speech therapy, because the child has learned to speak the wrong way over time. So after cleft surgery, make sure you you seek the professional help of a speech therapist to help your child learn the right way to speak. Now we have dentition issues. We have open bites, we have overbite. Open bite is when the child's teeth, that's the upper teeth and the lower teeth, do not meet like this. There'll be a space, like an arc up here and arc here. So there'll be a space such that you'll be seeing the tongue like this. I don't have open bite, so I can't demonstrate that. So the way open bites affect the child's speech is when the child wants to say sounds that requires the teeth touching the lip, like the F sound, the V sound, and any sound at all that requires the lip touching the teeth, the teeth touching the lip. The child won't be able to pronounce that because the upper teeth will not touch the lip due to open bite. And there is overbite. Overbite is when the upper dentition or the lower dentition is longer than it should be. So it extends like I don't know how to practice, describe it. So it's just that the teeth will be longer and it will overlap. There will be an overlap, the upper teeth or the lower teeth. So these things, they affect dentition. They affect the way speech sounds are made. So if a child has open bite, closed bite, overbite, whatever bite, if the dentitions are not right, there's a solution. Don't just leave things that way. You go to see a dentist. You take the child to see a dentist. And when the child sees a dentist, the dentist will tell you what to do. Okay. And another thing, it's important to note that for the case of open bite, that's the one where there will be space, the teeth will be too short, and the upper teeth and the lower teeth will not meet in the middle. In the case of open bite, the causes are thumb sucking. When a child sucks the thumb for a very long period of time, it can lead to open bites. The teeth here and here will not meet. It can even lead to the teeth. It will keep shifting the teeth to come forward. So the earlier you help your child stop that sucking habit, the better. Then also, there are some pacifiers that are very fanciful and beautiful. This is for parents of infants now. Pacifiers that are very fanciful. They are so fine, and the pacifier has a string, and then it has a toy hanging underneath the string, so that your child can pick the pacifier easily and then put it in the mouth easily. These kind of pacifiers, they are fanciful and good, but they can lead to open bites. They can lead to dentition issues because of the weight of the toy hanging on the pacifier. It's going to drag the teeth, the lower teeth, down. It's going to put weight on the gum, the lower gum. It's going to cause some dentition issues for your child. It's going to cause some tongue thrust issues for your child, which could lead to speech disorders. So when you see those fanciful pacifiers, don't go for them. Or even if you buy it at all, remove the cord or the string attaching the toy to the pacifier. That toy is going to drag the lower teeth downward. It's going to affect your child's dentition. And besides, I don't think any child above 3 months should be using pacifiers. Don't help shut your child up. Instead, engage the child. Let the child speak more. Let the child make sounds. When your child is crying, look for alternative ways to pacify the child. Play with the child. Look for engaging activities that can keep your child busy instead of just putting pacifier in the child's mouth. Imagine a child using pacifier throughout till age 1. You are depriving that child of speech opportunities, of speech sound opportunities, which your child should be developing. So after 3 months, I don't think you should use pacifier anymore, so that your child will be able to freely express himself or herself. I didn't use pacifiers for my children. Yes, that's me. So now, let's look at oral motor weakness as part of structural issues. Structural issues leading to speech disorders. Sometimes, as a result of underlying health issues, a child can have maybe oral motor defects, in the sense that the organ of speech, the organ responsible for speech, are weak. Maybe the tongue is weak. Maybe the diaphragm is weak, because speech comes from down upwards. The energy emanates from the diaphragm before it gets up. Maybe the diaphragm is weak. There are so many things. Oral motor defect. So there are so many things that could lead to speech sound disorder as a result of oral motor weakness. How do you know your child has oral motor weakness? Can they pucker their lips like this? Can they stick their tongue out? Can they move the tongue upward? Can they take it to the left, to the right? These are indications that the child might be having oral motor weakness. So if your child is having oral motor weakness, see a speech therapist for assessment. The speech therapist will let you know the options, the ways you can exercise, how the child can exercise the tongue or the organs of speech, and increase the strength in those areas so that the speech production will be good and clear. It will not happen overnight. Over time of therapy, with time, with exercise, oral motor exercises, with therapy, your child will get better and gain strength. So these are causes of speech sound disorders. Now, the fourth cause I'm going to talk about is medical condition. Medical conditions like autism. I know I mentioned it earlier. Lots of times when we see children with autism, sometimes they have speech disorders. Sometimes they are non-verbal, sometimes they are verbal, but they do not know how to speak the right way. So, medical conditions can lead to speech disorders, even like Down syndrome also. You know, children with Down syndrome usually have bigger tongue than other children. So the size of the tongue can affect the way the speech is produced. Also, the way Down syndrome affects the brain can affect the way a child can speak or understand what is being said. It's different for every child with Down syndrome. It's not the same for every child. Some children with Down syndrome may not be able to speak. Some may not be verbal, some may be verbal. Some may not be able to string sentences. Some may not be able to speak clearly because of the stubby tongue. So what you can do if you have a little one with Down syndrome is to go see a speech therapist who will do an assessment and let you know if your child needs therapy, and then, or if they can work with your child to help the child speak better. Some medical conditions like epilepsy too affect speech and language in children. So there are lots of medical conditions that could lead to speech and language disorders in children. Now, let me list some types of speech disorders. We have stuttering. We have cluttering. Stuttering, okay, stuttering is also known as stammering. We have cluttering, as when a child speaks too fast. Like, I'm getting to the school. That's cluttering. Everything is just cluttered. Then we have articulation disorder. We have selective mutism. We have childhood apraxia of speech. We have dyspraxia. We have lots of speech and language disorders in children. We have aphasia, even in children. We have aphasia. Aphasia is loss of words. Aphasia could be as a result of stroke. Yes, stroke occurs in children also. I've heard of a number of children who had stroke and as a result had speech disorder afterwards. So there are lots of things, even accidents, a child falling down. So that's why sometimes some elderly, some grandmas will tell you that, oh, it's normal for children to fall down. Please prevent your infant, your toddler from falling from heights as much as possible. Put them in safe places. Put them on leveled ground or floor instead of putting them on heights. Prevent them from falling, because falls, you can't determine what will happen. When a child falls and hits the head on the ground or floor, it could lead to different things happening to the brain. So prevent this from happening. Yes. So that's that. Now, how do we prevent speech and language disorders? How do we prevent it? Number one is pregnant women. If you are pregnant and you are watching this video, please do not take unprescribed medication. In fact, if you are pregnant and your doctor doesn't know you are pregnant, when they are making prescriptions, let them know, please, is this prescription, is this medication safe for me? You know, I'm pregnant. Let them know. Ask, just double check. Double check. And you too, you can also do research on whatever medication you are placed on as a pregnant woman. You can check, okay, does it affect pregnancy? Does it affect my baby's development? How does this medication affect me before you ingest it? Also, to our African and even Indian population who are used to herbs, taking herbs, herbal medicine, be careful. Be careful the way you take herbs when you are pregnant. In fact, stay off herbs because you do not know the chemical composition of that herb you are taking. You do not know how it will affect the growth and development of your inborn child. Also, stop giving herbs to infants and even toddlers. You know why it's not even safe to give herbs to children? Because you don't know the chemical composition. You don't know the quantity that is good enough or safe for your child. Don't just give children things randomly. Because herbs are chemicals. They contain chemicals. They contain chemical properties which could affect your child's growth and development, especially if you take too much of it. So be careful. So then we have Prevention of fall. Yes, I've mentioned that earlier. Try as much as possible, for emphasis sake, prevent your child from falling down from heights. Start communicating with your child as early as possible. If your child, when you have your child, even before delivery, talk with the inborn child. Discuss with the child. Tell the child, okay, we are going out today. We are doing this tomorrow. Yes, we are here. Even after delivery, talk to your child from day one. Your child will begin to get familiar with words and what they mean when you talk to them. This will help you. This will help your child communicate early. And also, when you start communicating with your child early, it will help you know early if something is wrong, especially when the child is not responding as they should. When you smile and laugh with your 9-month-old and the child is not responding, you are communicating with child and the child does not respond, it should raise concerns that, oh, why is this child not responding the way they should? And then you will know that, okay, let me ask the pediatrician. Let me ask the speech therapist, is my child developing as they should? Please make sure you watch last week's video on developmental milestones in speech and language. This will help you know when things are not going the right way, and it will help you know what to do early. Also, as soon as you feel your child is not communicating well, please seek help. And when you seek intervention, you are told that, okay, this is what the problem is. Start intervention immediately. You can start intervention at any age. It doesn't have to be when the child is 5 years and it does not resolve itself. That's when you now start. It might be late at that time. It might be late intervention. And when you start intervention late, you will not get results fast. You will not get fast results. But when you start early, as soon as you know this is what is wrong with my child, you will get a faster results. Now, that is that. Now, what to expect? Parents usually ask me, okay, my child is 2 years old and my child says just 5 words. My child is 1. Is it okay for my child to know and say just 3 words? If you have been communicating with your child will have more than 50 words in their word bank, even at age 1. Your child will understand up to 50 words at age 1 if you have been communicating with your child. So now, between 1.5 and 2 years, between 18 months and 24 months, we expect that your child would have 50 words they understand, that they can use, that they know the meaning. They know go, they know come, they know ball, they know bottle, and they can use these words. They can form 2 to 3 word sentences with these words they know already. So if your child is above 2 and does not use up to 50 words, it should give you concern. Please get the child assessed and start therapy as soon as possible. So, what should we expect from a 2-year-old? A 2-year-old should be able to tell you their name. It should be able to answer, what is your name? A 2-year-old should be able to say, my name is Patience. A 2-year-old should be able to follow and give directions. Where is your shoe? Over there. Or even if the child doesn't say over there, the child could just point towards the direction of where their shoes are. If you ask the child, where is your ball? The child will look around and point towards the direction, or say, I don't know. Your child should be able to give direction at 2, basic directions though. should be able to give directions and follow direction. You tell the child, go to the door. The child should be able to go to the door when you say so. You tell the child, come here. The child should be able to come at 2. You tell the child, go to the room. Go and bring something. The child should be able to follow that instruction at 2. And then your child should be able to string at least 2 words, to create a 2-worded sentence. So if your child is above 2 and your child cannot tell people their names or respond to what is your name, it should give you concern. If your child is not able to give or follow direction at the age of 2, you should be concerned. If your child cannot string at least 2 words together to make a sentence, drink water, mommy go, mommy come, no mommy, no daddy, you should be concerned. If your child is above 2 and cannot do these things, please try and go for an assessment. Take that child for an assessment, and then we will know what is wrong with the child. We'll be able to tell you, okay, this is why your child is not speaking well. This is what you can do. If it's something you can fix on your own, the speech therapist will tell you, okay, play with your child, do this, do that, and your child will get better. If your child does not get better within the span of six months, please come back for a review or a reassessment. I have done at least 4 assessments this year that the parents were concerned. The parents who brought their children for assessment, they were concerned that my child is 2 and my child doesn't speak, or my child isn't speaking well. My child is 3 and my child isn't speaking well. And when they brought the child, I did the assessment. And after the assessment, I realized there was nothing wrong with this child. The child has language. The child has speech. But the child isn't playing well. The child isn't playing as they should. Nobody plays with the child. The parents are not communicating with the child. So that was why the child wasn't speaking or didn't have enough words in his word bank. But after that, after the assessment, I told them, your child does not need speech therapy. No, your child does not need speech therapy. Your child is fine. Do this, do this, do that. That was after assessment. I told them what to do. And all 3 parents that I have seen in the past 4 months, even immediately after the assessment, and after I gave them the reports and I told them what to do, they started what I suggested, and their children are doing better now. They are speaking better and communicating better. So if you have concerns that your child is not meeting up with the milestones, the speech and language milestone, please take that child for an assessment. Let's rule out speech and language disorders. Don't listen to people who will tell you, oh, my son spoke at 6. There is no problem. The child will speak when he's ready. What if there is a problem? What if there is an underlying problem and you now decide to wait until the child is 12 and you see that the problem is not resolving itself, the child is still having speech and language defects? Then you now decide, okay, maybe I should now take the child for therapy. It might be late to work with your child at that stage. If it was a structural problem, it would have been fixed when the child was much younger. The child would have healed. Maybe the child would not even know that they once had speech defects. Please, if you know your child is having speech and language disorder, as soon as you know, take that child to see a speech therapist for assessment. After the assessment, the speech therapist will tell you what is recommended, what you should do. And please do it. and your child will be fine. So that is the end of today's live video. Our next I'll be coming live in 2 weeks time. I think the last Thursday of September, and I'll be live with a lawyer who will be telling us about our rights, our children's rights, the rights of a child with special needs. You know, lots of parents usually complain that my child's school has said I should stop bringing the child because my child has disability. I took my child to a certain school and they rejected my child. Or even in the case of abuse, because sometimes people in the environment take advantage of children's disability and abuse them sexually, physically, emotionally. What is the child's right? What is the right of a child with special needs? So we'll be discussing that on the last Thursday of September. I'll be live with a lawyer here, and the flyers will be out soon. I would send reminders. I would post and remind us when the time comes. Thank you so much, Ojeleye Oluwatosin, for coming online today. Thank you, Michael Usman Oluwatobi. Thank you, Ogunyemi Olakunle. That's a senior colleague, yes. Thank you, Adebayo Adebisi, for joining us today, another senior colleague. Thank you, Lillian Ama. Thank you, Joy. Thank you, Maureen Dongri Takuchi. Thank you, everyone. Olabisi Akomo, my colleague in Abuja. Thank you, everyone, for joining us today. And those who will watch this video later, thank you in advance. Do not forget to subscribe to the YouTube channel. Just search for Speechy Haven on YouTube. Subscribe, turn on your notification bell, and like the video. Please share with parents of infants and toddlers, even if they do not have disabilities. Share with pregnant women. They need to know some of these things we've discussed today. Thank you so much. I remain Patience Oyeme Olaiya. Bye for now.